Hello and welcome. Today, we're diving into a complex and challenging condition known as Friedreich's ataxia, focusing specifically on its impact on the heart. Friedreich's ataxia is a rare, inherited disease that primarily affects the nervous system, but its cardiac complications can be life-threatening. Understanding this aspect of the disease is crucial for effective management and improving patient outcomes. At its core, Friedreich's ataxia is caused by a genetic mutation. Specifically, it's an autosomal recessive disorder, meaning that an individual must inherit two copies of the faulty gene, one from each parent, to develop the condition. The gene involved is called XN, which provides instructions for making a protein called frataxin. The most common mutation is an expansion of a DNA sequence known as a GA repeat within the FXN gene. This expansion disrupts the production of frataxin, leading to a deficiency of this vital protein. Frataxin is essential for the proper functioning of mitochondria, the powerhouses of our cells. It plays a key role in iron regulation within these organelles. When frataxin is deficient, iron accumulates in the mitochondria, leading to the formation of damaging free radicals. This oxidative stress injures cells, particularly those in the nervous system and the heart. In the heart, this damage results in thickening of the heart muscle, a condition known as hypertrophic cardiomyopathy, as well as other electrical and structural abnormalities. Friedreich's ataxia is relatively rare, affecting an estimated 1 in 40,000 to 50,000 individuals worldwide. Because it's an autosomal recessive condition, both parents must be carriers of the mutated gene, even if they don't exhibit any symptoms themselves. The onset of symptoms typically occurs in childhood or adolescence, but can sometimes appear later in life. The prevalence may vary slightly depending on the geographic location and population studied. The signs and symptoms of Friedreich's ataxia are diverse and progressive. Neurological symptoms often appear first, including difficulty with balance and coordination, known as ataxia. This can manifest as unsteady gait, frequent falls, and slurred speech. As the disease progresses, muscle weakness, fatigue, and impaired sensory perception may develop. Cardiac involvement is a significant concern, leading to shortness of breath, chest pain, palpitations, and even heart failure. Other common symptoms include scoliosis, diabetes, and vision or hearing problems. Diagnosis of Friedreich's ataxia typically involves a combination of clinical evaluation and genetic testing. A neurologist will assess the patient's symptoms, reflexes, and coordination. Magnetic resonance imaging, or MRI, of the brain and spinal cord can help rule other conditions. Electrocardiograms, or ECGs, and echocardiograms are used to evaluate heart function and detect any structural abnormalities. Ultimately, genetic testing confirms the diagnosis by identifying the GAA repeat expansion in the XN gene. While Friedreich's ataxia itself doesn't have distinct classifications or types, the severity and progression of cardiac involvement can vary significantly among individuals. Some patients may develop mild cardiomyopathy with minimal symptoms, while others may experience severe heart failure requiring advanced medical interventions. The age of onset and the length of the GA repeat expansion can influence the severity of the disease and the rate of progression. Currently, there is no cure for Friedreich's ataxia, so treatment focuses on managing the symptoms and improving the quality of life. This often involves a multidisciplinary approach, including physical therapy to maintain strength and flexibility, occupational therapy to adapt to daily activities, and speech therapy to address communication difficulties. Medications may be prescribed to manage symptoms such as muscle spasticity, pain, and diabetes. Cardiac complications are managed with medications to control heart rhythm, reduce blood pressure, and improve heart function. In severe cases, a heart transplant may be considered. Since Friedreich's ataxia is a genetic disorder, there's no way to prevent the condition itself. However, genetic counseling is crucial for families with a history of the disease. If both parents are carriers of the mutated gene, there's a 20% chance that their child will inherit the condition, a 5% chance that the child will be a carrier, and a 25% chance that the child will inherit two normal genes. Genetic testing can help determine carrier status and inform reproductive decisions. The prognosis for individuals with Friedreich's ataxia varies, but it's generally a progressive and debilitating condition. Cardiac complications are a major determinant of life expectancy. With advances in medical care and symptom management, many individuals are living longer and enjoying a better quality of life. Recent research is focused on developing new therapies that target the underlying genetic defect, such as gene therapy and frataxin-enhancing drugs. These promising avenues hold hope for slowing disease progression and improving outcomes in the future.